Good morning, everyone. We are Group 3 and we're here to present our topic for today, which is the respiratory system and its part and function. Before we start, let us first define what is the respiratory system. The respiratory system is the network of organs and tissues that help you breathe. It includes airways, lungs, and blood vessels.
Next is the respiratory system function. It's also known as pulmonary ventilation. Air is inhaled through the nasal and oral passages in pulmonary breathing, the nose and the mouth. It enters the lungs via the pharynx, larynx, and trachea. The air is then breathed, returning to the same path. So next is air vibrating the vocal cords creates sounds. Phonation is the creation of sounds by structure in the upper respiratory tract of the respiratory system. So during our exhalation, air passes from the lungs through the larynx or the voice box. So when we speak, muscles in our larynx move the arytenoid cartilages, so the arytenoid cartilages push the vocal cords or the vocal folds together. Next is olfaction or smelling is a chemical sensation. The olfactory fibers that lines the nasal cavities inside the nose start the olfactory process. Some substances in the air bind to and activate nervous system receptor on the cilia as air enters the cavities. So the main function of respiratory system include transporting air into and out of the lungs, protecting our body against into harmful particles, and its most important function is the exchange of oxygen and carbon dioxide. So it's basically about breathing.
So the principal purpose of respiration is to supply trillions of cells inside our body with oxygen and to remove those carbon dioxide gases produced by different cellular activities happening inside our bodies. There are three respiration processes. First process is what we call ventilation or breathing, which is the movement of the air between the atmosphere and the lungs. Ventilation has two phases. First is inhalation or inspiration to move air into the lungs, and next is the exhalation or expiration to move air out of the lungs. As we can see here in the picture, during inhalation the diaphragm contracts, while during exhalation the diaphragm relaxes. The second and third processes of respiration involve the exchange of the gases within our body. The second process is what we call the external respiration, which is the exchange of gases between the lungs and the blood. The third process is what we call the internal respiration, which is the exchange of gases between the blood and the body cells. So as we can see here in the picture, during the external respiration, the oxygen diffuses from the alveolar air into the blood. While in internal respiration, the oxygen diffuses out from the blood into the body tissue.
Parts of respiratory system. So the first part of respiratory system is the cyanosis. It is a hollow spaces in the bones of your head and small openings connect them to the nasal cavity. So the cyanosis help to regulate the temperature and humidity of the air you breathe in, as well as to lighten the bone structure of the head, and it is responsible to give tone to your voice. There are 4 different types of cyanosis. First is the frontal cyanosis, which are located above your eyes. Second is the ethmoidal cyanosis, which are located between your eyes. Third is the maxillary cyanosis, which are located below your eyes. And lastly, the sphenoidal cyanosis, which are located behind your eyes. So the cyanosis make thin mucus that drains out of the channels of the nose. This drainage helps keep the nose clean and free from bacteria, normally filled with air, and the cyanosis can get blocked and filled with fluid. Another part of respiratory system is the nasal cavity, which we commonly known as nose. So nasal cavity is the best entrance for outside air into the respiratory system. And there are tiny little hairs that line the inside wall of our nose, and it is responsible for cleansing system. Next is the oral cavity, which we commonly known as mouth, where air can also enter through your and especially if you have a mouth breathing habit or your nasal passage may be blocked temporarily. Air can also enter through oral cavity or mouth. Next part of the respiratory system is the adenoids. Adenoids is an overgrown lymph tissue at the top of the throat where your adenoids interfere with your breathing. They are sometimes removed. The lymph system, consisting of nodes, knots of cell, and connecting vessels, carries fluid throughout the body, and this system helps your body resist infection by filtering out foreign matter, including germs, and producing cells, lymphocytes to fight them. So adenoids do important work as infection fighters for babies and young children, but they become less important as a child gets older and the body develops other ways to fight germs. Next is the tonsils. It is a lymph nodes in the wall of your pharynx. Tonsils are not an important part of germ-fighting system of the body. If they become infected, they are sometimes removed. Though small and seemingly useless, tonsils have several uses. The tonsils prevent foreign objects from slipping into the lungs. Think of them as a goalies for the throat. They are also filter bacteria and viruses. On top of all of that, they produce white blood cells and also they are once antibodies. Next part is the pharynx, which we commonly known as throat. So pharynx is the one who collects incoming air from your nose and passes it downward to your trachea, which is the windpipe.
The next part of the respiratory system is the epiglottis. It is a small, movable lid just above the larynx that prevents food and drink from entering your windpipe. It closes over the trachea when you swallow. Next is the larynx, or we can call it the voice box. It is the upper part of the respiratory system which contains the vocal cords. Next is the esophagus. It is the muscular tube that carries food and liquids from your mouth and throat to the stomach. Next is the trachea or the windpipe. It is the passage that carries oxygen-rich air from the pharynx to your lungs. Next is the ribs, the bones that protects and supports the chest cavity and also aids in breathing. Next is the bronchi or tubes. The trachea divides into two main bronchi tubes, one bronchi for each lung. These bronchi tubes are two large tubes that carry air from the windpipe to the lungs. These bronchi are subdivided further into bronchioles. Next is the right and left lungs. These are the spongy, elastic organs on each side of the heart, enclosed in the rib cage and composed of millions of air sacs called the alveoli. The right lung is divided into three lobes or sections: the superior lobe, middle lobe, and inferior lobe. The line that divided these three lobes is called the horizontal fissure. Next is the left lung. The left lung is divided into two lobes only. These are the superior lobe and the inferior lobe. Both of the right and left lung have the oblique fissure in their lower part. Next is the pleura. It is a thin layer of tissue that covers the lungs and lines the interior wall of the chest cavity. It protects and cushions the lungs.
So we have here cilia and mucus. Cilia are tiny hairs that help clean the air before it goes to the lungs. The bronchial tubes are lined with cilia that have a wave-like motion. This motion carries mucus or the sticky phlegm or liquid upward and out into the throat, where it is either coughed up or swallowed. The mucus catches and holds much of the dust, germs, and other unwanted matter that has invaded your lungs. Your lungs get rid of the mucus through Coughing. So basically, mucus is the moist and sticky that captures dust, germs, and microorganisms that could irritate the lungs. So coughing is our body's defense mechanisms to get rid of the phlegm or the mucus that trap microorganisms. Muscles help move the air you inhale into and out of your lungs. Some muscles included in the respiratory system is the diaphragm. It is the main respiratory muscle. As you can
Diseases
see
of
at the picture,
respiratory.
it
The
is a
first one
dome
is
shape
asthma.
that
Your
separates
airways
your
narrow
chest
and make too
cavity
much
from
mucus.
your abdominal cavity. By moving downward, it creates suction to draw in air and expand the
The third
lungs.
one is chronic
During this
obstructive pulmonary
breathing
disease.
process, the diaphragm
This
is
long-term
busy doing
condition
its work.
get worse over time.
So,
It
if we
includes
inhale,
bronchitis
the
and
lungs
emphysema.
expand and the
The
diaphragm
fourth
moves
one is
downward,
pneumonia. An
while
infection
when we
causes
exhale, the
inflammation
diaphragm
in your
relaxes
alveoli.
and returns
They
to
might fill
its
up with
normal
fluid or
shape.
pus.
Next, we have the smallest section of the bronchi, which is called bronchioles, at the end of which are the alveoli. So basically, these are small bronchial tubes or the passageway of air which eventually deliver air to alveoli. Next, we have the alveoli, the very small air sacs that are the destination of air that you breathe in. The alveoli are tiny air sacs like grapes in a bunch located at the end of the bronchioles and all surrounded by blood capillaries where the gas exchange happens. So the alveoli pick up the incoming oxygen you breathe in and release the carbon dioxide, which is a waste product. That's why we exhale it. Next, we have capillaries, blood vessels that are embedded in the walls of the alveoli. Blood passes through the capillaries, brought to them by pulmonary artery and taken away by pulmonary vein. While in the capillaries, the blood moves carbon dioxide into the alveoli and takes up oxygen from the air into the alveoli. So here, the oxygen you breathe in diffuses through the alveoli and the capillaries into blood. The carbon dioxide you breathe out is diffused from capillaries to the alveoli up to the bronchial tree and out of your mouth or your nose. So basically, alveoli and capillaries function together. The walls of alveoli are very thin. This lets oxygen and carbon dioxide pass easily between the alveoli and capillaries, which is the smallest blood vessels. Next.
Diseases of respiratory. The first one is asthma. Your airways narrow and make too much mucus. The second one is bronchiectasis. Inflammation infection make your bronchial walls thicker. The third one is chronic obstructive pulmonary disease. This long-term condition get worse over time. It includes bronchitis and emphysema. The fourth one is pneumonia. An infection causes inflammation in your alveoli. They might fill up with fluid or pus. The fifth one is tuberculosis. A bacterium causes this dangerous infection. It usually affects your lungs but might also involve your kidney, spine, or brain. The last one is lung cancer. Cells in your lung change and grow into a tumor. This often happens because of smoking or other chemical you breathe in.
Cystic fibrosis. This disease is caused by a problem in your genes and get worse over time. It causes lungs infection and that don't go away. Cystic fibrosis or CF is an inherited disorder that causes severe damage to the lungs, digestive systems, and other organs in the body. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids are normally thin and slippery, but in a people with CF, a defective genes cause the secretion to become sticky and thick. Instead of acting as a lubricant, the secretion plug up tubes, ducts, and passageway, especially in the lungs and pancreas. Although cystic fibrosis are progressive, and requires daily care, people with CF are usually able to attend school and work. They often have a better quality of life than people with CF had in the previous decades. Improvements in screening and treatments means that people with CF now may live into mid to late 30s or 40s, and some are living into their 50s. Next is pleural effusion. Too much fluids builds up between the tissues that line your lungs and chest. A pleural effusion is collection of fluid abnormally present in the pleural space, usually resulting from excess fluid productions and or decreased lymphatic absorption. It is the most common manifestations of pleural disease, and its etiologies range in the spectrum from cardiopulmonary disorder and or systemic inflammatory condition to malignancy, or approximately 1.5 million pulmonary pleural effusion are diagnosed in the United States each year. Next is idiopathic pulmonary fibrosis. Your lung tissues become scared and can work the way it should. Idiopathic pulmonary fibrosis, or IPF, is a condition in which the lung becomes scared and breathing becomes increasingly difficult. It's not clear what causes it, but it usually affects people who are around 70 to 75 years old, and it is rare in the people under 50. Several treatments can help reduce the rate at which IPF gets worse, but there's currently no treatment that can stop to reverse the scarring of the lungs. There are some symptoms of idiopathic pulmonary fibrosis, or IPF, that develop gradually to get slowly worse over time. Symptoms can include shortness of breath, a persistent dry cough, tiredness, loss of appetite and weight loss, round and swollen fingertips. And the last one is sarcoidosis. Tiny clumps of inflammatory cells called granulomas form often in your lungs and lymph nodes. Sarcoidosis is a disease characterized by the growth of tiny collection of inflammatory cells, or granulomas, in any part of your body, most commonly the lungs and limbs. But it can also affect the eyes, skin, heart, and other organs. The cause of sarcoidosis is unknown, but experts think it results from the body's immune system responding to unknown substance. Some research suggests that infection agent, chemical, dust, and a potential abnormal reaction to the body's own proteins or cell proteins could be responsible for the formation of granulomas in a people who are genetically predisposed. There is no cure for sarcoidosis, but most of the people do very well with no treatment or only modest treatment. In some cases, sarcoidosis goes away on its own. However, sarcoidosis may last for years and may cause organ damage. Hope you understand and learn something about our report. Thank you and goodbye.
And here are the references that we have used. And thank you everyone for listening in our presentation.